ERCP still plays a major diagnostic role in regard to biliary strictures, but nonetheless, there is room for significant improvement. It is sufficient to say that reports show that 2/3 of indeterminate biliary strictures are malignant, but 1/4 of all surgical resection specimens for this indication were reported as benign disease. While other techniques have benefited from the introduction of more sophisticated technology, until now the techniques and technology for ERCP tissue collection have remained largely unchanged and possible improvement neglected, notwithstanding the importance of the technique and its potential performance. When we decide to approach an indeterminate stricture to obtain tissue samples, we have to consider the following key considerations and points before undertaking the procedure. The first are the technical aspects: choice of device, the choice between biopsy or brushing, and the technical challenges during sample acquisition, and of course to have adequate fluoroscopy imaging. Then we have to consider lesions and their surroundings. First of all, the characteristics, and of course difficult locations, in particular to consider curves and angles in biliary tracts. The Infinity ERCP sampling device is purpose-built for collecting substantial and quality samples from strictures in the biliary duct. It represents an important step forward.
So this is the Infinity ERCP brushing. It has a distal and proximal stiffer bristles to help to create a defect into the tissue, and a certain portion with softer bristles to capture the abraded material. There are also two spaces between the two types of bristles to help collecting PET cells into the catheter.
There are two different catheter sizes. The 7.5 French is more flexible and suitable for very tight strictures and for approaching very angled and curved tracts. The 9 French catheter is slightly larger and may make traversing a stricture somewhat more difficult. Forceps biopsy is more time-consuming and more technically challenging than brush cytology because it is sometimes difficult to insert thick forceps into the bile duct and grasp a targeted specimen. However, it could provide a sample of bile duct tissue from deep in the epithelium, which is expected to improve diagnostic yield.
The histoguide, it's a wire-guided biopsy forceps to gather specimen into the bile duct. Has two serrated jaws for grasping, and its characteristic is good visualization under fluoroscopy, so you can perform a tissue sampling in a safer way.
Brushing had always been considered an easy, cheap and fast method to acquire a cytological specimen. But despite a specificity of nearly 100%, the sensitivity is still around 45%. Fluoroscopically guided forceps biopsy sampling has been individual sensitivity of 35%. But when this technique is combined with brushing, the cancer detection rate improved to 63%, which is a very good result for such a demanding procedure. A compelling reason to increase investment in ERCP tissue technology is that it leads to a significant reduction in unnecessary surgery. Articles in peer-reviewed journals are positive in their assessment of the Infinity ERCP and recommend its increased use, especially by experienced staff. It's important to stress that the device is only one of a number of factors that determine successful tissue acquisition. Finally, I want to say that for optimal result, we need to identify the weak links in our chain and make them stronger.